This is a fantastic question. I can't give personal medical advice, but I'll tell you just in general what we do in this situation. So say you have a breast augmentation and a breast lift at the same time, and you have an anchor pattern incision. What do you do when you get an opening in the wound? Now, when you get an opening in the wound, it's almost always just where you describe it, at what we call the T-junction, where the vertical meets the horizontal incision. So that's an area with the most compromised or damaged blood supply based on how we do surgery, and that's almost always where we have trouble. So I'm more aggressive with managing these than some surgeons are, so I will start with telling you what I do. So I don't like wounds in that area. So anything other than a tiny 1 or 2 millimeter scab, I usually clean the area out and reclose it for my patients, and I often put a wound vac over it. The reason why is there is an implant lurking beneath, and I don't want any access for bacteria to get to that implant. So I tend to be really aggressive with closing these things if they open up a little. Now, not everyone does that. So if you have an opening and it's superficial, meaning that it's just the skin and the deeper tissue looks like it's healthy and together, a lot of surgeons will treat that with just wound care. Now, how much wound care really depends on how large it is and how deep it is. So things that are very superficial often just need ointment and a dry dressing. For things that are deeper, sometimes they need more. Sometimes you need some kind of packing. If it gets to that point, that's not my preference because, again, there's an implant lurking beneath, but some surgeons do that. Now, there's all kinds of fancy wound care that we use in surgery, and there's special dressings that will help heal things faster. Your surgeon may have some specific recommendations for you based on how your wound looks. Now, wounds by themselves are not an indication for having antibiotics. Open wounds rarely become infected, but again, there's an implant lurking. So surgeons are often more likely to prescribe antibiotics in this situation than they would be for just a lift without an implant. So just in summary, so if you have a little opening after an augmentation and a mastopexy, if it is superficial and small, usually just local wound care is fine. And what that will be will depend on your surgeon's preferences. If it's a little deeper, you can sometimes pack the wound or put dressings within the wound, not just over top. I'm not a fan of that. I tend to like the next step, which is to clean the area up surgically and to reclose everything with or without some kind of vac or healing device or negative pressure device over the incision. So that's the typical things we do for an opening in the T-junction. It's always stressful for all involved when there's an implant underneath, and so we tend to be more aggressive managing these wounds than we would be for a similar wound for a lift or reduction.